Hello, I'm Dr. Akash Dhuru, surgical oncologist at Criticare Hospital. Let's talk about cancer, which is most common in India in females, that is breast cancer. So the incidence of breast cancer has been increasing not only in urban areas but also in rural areas, and the incidence of cervical cancer has been decreasing. So let's talk about what are the risk factors and what are the screening guidelines for breast cancer. Risk factors can be divided into modifiable and non-modifiable. Non-modifiable include age, genetic predisposition, having a family history of breast cancer. Modifiable risk factors include your late age of marriage, late age of childbirth, avoiding breastfeeding, intake of alcohol, intake of tobacco, obesity, lack of exercise. So these are modifiable risk factors. So let's talk about screening. What is screening? So screening is are the investigations are done on a normal individual to detect cancer early. For breast cancers, these can be divided into investigations for a patient having a high risk and patient having an average risk. If a patient is having an average, doesn't have a family history of breast cancer or no genetic predisposition, then if the screening starts from the age of 25 when the person has to do her self breast examination and a clinical breast examination that is visited that examined by a clinician, that is a physician, every yearly. So why screening is important? Because screening helps you to detect the breast cancer early. Now, early detection of breast cancer is important because if we have seen that if we detect it early, then it will be in an earlier stage of cancer. So if the breast cancer with stage 1 has a 5-year survival of 95% compared to the 5-year survival in stage 4, which is only 21%. So I urge all of you to follow these strict screening guidelines and protect yourself from breast cancer.